virtual beds across five hospitals. In 2026, I'm focused on making care easier and faster to access. While improvements are evident, regional variation remains too high. For example, in the Midwest, 98% of urgent breast cancer referrals are seen on time, while in the West and Northwest, it's just 39%. In the Southwest, 74% of audiology patients are seen within the 52-week target, compared with only 48% in Dublin and the Midlands. And that sort of level of variation is not acceptable, and it is avoidable. And so we must do better with that. On urgent and emergency care, we are driving, I hope, lasting improvements in urgent and emergency care, though there is significant variation. I track hospital figures absolutely daily, and I've identified Waterford as continuously performing well and others greatly improving. In Tallaght, for example, greatly improving. UHL, that the Deputy just referenced, is one of the best performers in terms of weekend discharges and the way in which the hospital is organised, and has had enormous improvements in the emergency department, but it simply doesn't have enough beds. And there's 96 beds, which I'm opening there on Monday. I hope to see you there. And again, we have a plan for an immediate response in terms of acute inpatient beds, but the needs of the region are more complex. But in any event, we need consistency across all our sites to ensure equitable care. On waiting times more broadly, we are expanding access to services 7 days a week, and our early results show that reforms are delivering, in some places, shorter waits, faster discharges and better outcomes for patients. For example, at the Mater Hospital, there's 81% of the consultants are on the public-only consultant contract, and the fact that they are being routinely rostered on Saturdays has helped us achieve a 39% drop in the trolley numbers there in the early part of this year. We're also seeing actual use of the theatres at the weekend. We're seeing certain outpatient clinics happening at the weekend. In Drogheda, for example, they have 3 of their 7 theatres working over the weekend. And gynaecology, surgical work done there since August 2025. And just important examples, though, in different hospitals that I'd love to go through in great detail, but what we need is to have that consistent across the health service. And we're trying to get better bang for the money that we put in. Beaumont Hospital this year has reduced the number of people waiting on trolleys by 30%, despite rising attendances of nearly 6% increase. In community services, I'm very aware that families face real challenges accessing some community care. Therapy waiting lists show very stark regional differences. The West and North West perform best in occupational and speech therapy, while Dublin and North East lead in physiotherapy, whereas South West and Dublin Midlands need to improve in these specialisms. To truly deliver better patient outcomes, though, we have to invest not only in treatment but in prevention. So we're expanding screening, vaccination and action on smoking and substance misuse. RSV infant immunisation has reached 88% uptake on the maternity sites, but it's only 40% in the community programme. We will try to bring this back once the flu vaccine is stood up, but we will incorporate this into the primary care vaccination programme in 2026. Cervical check screening has the 3rd highest uptake in Europe, combined with HPV vaccination, which is at 73%, which is one of the highest in Europe, though we want it to be 90%. It is one of the highest in Europe, but combined with that, we are on a path to eliminating cervical cancer. We are expanding breast cancer screening, and we are making bowel screening much more accessible, including through pharmacies, through the new pharmacy contract. On medicine expenditure, both within hospitals and in how we support people in the communities through the drugs payment scheme, exceeded €3 billion last year. That's twice the budget of the Department of Defence. It is an enormous investment in our people all of the time. This year, we are allocating an additional €217 million to our medicine spend, including 30 million specifically for new drug approvals. One of my priorities is increasing capacity. That means more beds, more surgical hubs, which we are seeing, more digital and virtual services. We'll see the 96-bed ward. We've had 201 beds open this year. The surgical hub is making a huge difference in Mount Carmel. It's reduced the day case waiting list in St James's by over 18%. Significantly reducing the plastics waiting list, which means breast reconstruction for 21% more people than had been the case before, 80% reduction on the pain management list from James's. It is very, very important. In 2026, we'll open 172 new acute beds, 324 community beds, and we will finish and open the 4 new surgical hubs in Galway, Limerick, Cork and Waterford. We're also expanding virtual acute wards in 5 locations: Galway, Mercy, Cork, Kilkenny, Drogheda and Tullamore.
Gareth Mahon.